You are listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back. You're listening to the Your Knee, Your Health podcast, and I'm Adam Rosen. In today's episode, I want to talk to you about blood cancers, leukemia and lymphoma. My daughter and her friends have been involved for a number of years in the local chapter for the Leukemia and Lymphoma Society in raising money, and the new campaign just kicked off. So I thought it was a very good topic to cover here because, it's something that people have heard of, but I'm not sure that they're very well educated or truly understand the differences in some of the leukemias and lymphomas and what they are. The students have done a great job. We had some unfortunate personal experience with family members, and I think that's what gave her firsthand knowledge of, what people do go through when they're diagnosed and how they're treated. And it really stimulated, her desire to try to help others. And every year they do this fundraising event to raise money as well as educate people around the area. So it's something that I'm sure is happening in your local area and something that you can look into as well. So, just some scary statistics though, but every 3 minutes, a person in the United States is diagnosed with a new blood cancer. And almost 10% of the new cancer cases that are diagnosed in the U.S. each year are one of these types, these leukemia or lymphoma cancers. And although survival rates have been improving decade by decade, a person still dies from a blood cancer every 9 minutes. So, it's one of those things where it's very, very important to further research and to try to do our best to, cure those people that are unfortunately diagnosed with these diseases. So the most common ones that people are familiar with, they're very, commonly you'll hear about Hodgkin's and non-Hodgkin's lymphoma. These lymphomas, these are cancers that occur typically in the lymphatic system. Hodgkin's lymphoma is one of the most curable forms of cancer, luckily, but it's still a problem and it affects the lymphatic system. So there's a change in the DNA of one of these types of white blood cells called a lymphocyte. And you may even hear, especially for those that are interested in science or medicine and medical school, you hear about this cell called the Reed-Sternberg cell. But these are diagnosed, typically diagnosed with a lymph node biopsy. And treatments may range anywhere from chemotherapy to radiation to stem cell transplantation. Now, the other type of lymphoma, which is also probably more commonly heard of, is what's called non-Hodgkin's lymphoma. So again, this is a blood cancer that develops in the lymph nodes, and it can affect one of the three main types of cells that we have. So there's B cells. This is the most common form of non-Hodgkin's lymphoma. There's T cells, and there's also what's called natural killer cells, or NK cells. They typically fight off things like viruses. So again, if you're diagnosed with one of these, you may have some swollen lymph nodes. You might have some, abnormalities on your blood test. The doctor may do a lymph node biopsy to confirm, and then again, treatments typically radiation or chemo. But this is a lot more specific to the very particular type of non-Hodgkin's lymphoma that somebody has. And then there's a whole bunch of leukemia. So a leukemia is a blood cancer that begins in a cell in the bone marrow. And what typically happens is that when this cancer cell, or it's typically a cell that then changes into a cancer cell, it overtakes all of the normal cells. So basically it just grows out of proportion. So, the four main types that you've probably heard of: ALL, AML, CLL, and CML. So when we talk about the ALL or AML, these are what we call acute versus chronic. So acute are things that happen a lot more quickly, rapidly, and they can be also a lot more devastating. So ALL, or acute lymphoblastic leukemia, also sometimes termed acute lymphoid leukemia. This is an overall decrease in the number of healthy cells because this cell changes and it grows out of proportion. So what happens is all of your normal cells, like your red blood cells and your white blood cells and your platelets that need to grow in the bone marrow from the stem cells, can't, because they're just being overwhelmed by all these other cells. And this causes a lot of problems because if you don't have red blood cells, you become anemic. You have a low blood count. If you don't have white blood cells, you become neutropenic. And if you don't have platelets, you become thrombocytopenic. And that's a problem because if you're low in your blood count, you're anemic, you can be tired. You may have low blood pressure. You could pass out. It can affect other organ systems because you can't get oxygen to them. And if you have low white blood cells, you're more prone to develop an infection because you don't have the cells that typically would fight those infections off. And if you don't have platelets, you can actually have bleeding that can occur, or if you do get cut or injured or have surgery, you may bleed uncontrollably because you don't have these cells that stop the bleeding once it occurs. So more commonly, we see this in men more than women, and most commonly in whites and Hispanics. There's certain genetic disorders where people may be more prone to get this type of disease. And it's seen more commonly in younger kids or people over the age of 70. So when this is suspected, you first see this typically on blood tests, and then, to get a better diagnosis and confirm, typically a bone marrow biopsy is done. Most commonly, treatment's done with chemotherapy and sometimes stem cell transplantations. So the other acute form of leukemia is acute myeloid leukemia. So again, the DNA is damaged, and you make these cells turn blasts, and these blasts just grow out of proportion. Millions and billions of these cells, they're not normal cells, and they just take over everything. So again, you don't have these other normal cells, which our body needs to survive. So again, treatment, typically blood tests, bone marrow biopsy, and you need chemo, radiation, or rather chemo and stem cell transplantations to address these. Now, there's two chronic forms. So there's CLL and CML. So chronic lymphocytic leukemia. This is something that progresses very slowly typically. It can occur quickly, but more commonly, it's this slow chronic lymphocytic leukemia. And usually, it doesn't typically cause significant problems. This is one of these kind of cancers where if it's chronic, it's slow growing, and patients are okay. It's kind of a watchful waiting. It's this cautious observation and just making sure that with blood tests that everybody does okay. The one particular group that they have seen patients develop this in are people that are Vietnam vets that have been exposed to Agent Orange. And although it can progress quickly or rapidly in some people, the slow-growing one you can kind of watch. Now, if you do get more symptoms or it's this rapid growing, occasionally those patients need chemo and other treatments. And the last major sort of common form is this CML, or chronic myelogenous leukemia, sometimes also called chronic granulocytic or chronic myelocytic leukemia, more common in men than women. And is more common as we age. And typically, this can be treated with oral medications based on the changes that occur. Now, there are a number of other leukemias. So these are a little bit more rare, things like hairy cell leukemia, chronic myelomonocytic leukemia, juvenile myelomonocytic leukemia, and then the B cell and T cell prolymphocytic leukemias. And then there's other similar diseases that may affect the body. So you may have heard of people that have developed myeloma or myeloproliferative dysplasia and things like that. So, just sort of a brief overview, just to kind of let you know some of the things about the types of lymphoma, Hodgkin's and non-Hodgkin's, and some, basic brief overviews, of leukemia. But just, again, as a scary statistic reminder, every 3 minutes, a person in the U.S. is diagnosed with one of these blood cancers. And every 9 minutes, somebody dies from one of these blood cancers. So, you may know somebody that has this or has been diagnosed or is being treated or has treated, is currently under treatment, or potentially may have passed away from one of these blood cancers. So this is just an informative way just to kind of lay the information out there. I'll put the link in the show notes for the Leukemia Lymphoma Society. They have a great website that you can go to and learn more about these diseases. And they also have excellent ways that you can find local chapters where you can donate money in the hopes that you can help promote the research, which is going to help fund those scientists and these institutions in their goal to come up with treatments that help treat and potentially cure these diseases. So thanks again for listening. I'm Adam Rosen. You've been listening to the Your Knee, Your Health podcast. Until next time, stay safe. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.